Hi everyone, I will be discussing a case of a wrist MRI today where a patient presented with ulnar-sided wrist pain. So following a patterned approach, I would first look at the bones where there is no evidence of bone marrow edema in the distal radius, ulna, the carpal bones or the metacarpals. However, small intraosseous cystic changes are noted in the scaphoid and lunate. Okay, the rest is the articular cartilage, which is absolutely fine along the radiocarpal, the midcarpal and the carpal metacarpal articulations, and there is no evidence of synovitis along with other than trace fluid in the distal radioulnar joint. Okay, next comes to the evaluation of triangular fibrocartilage, where I see that the radial attachment of TFCC is bang normal. However, there is mild degeneration at the ulnar attachment along the fovea and ulnar styloid attachment. There's no evidence of tear in the TFCC. Okay, next is the scapholunate ligament and the lunar-triquetral ligament. They are fine. However, there is mild degeneration of the scapholunate ligament. We can see in one of the fibers here, but otherwise largely the fibers are intact. Evaluating the dorsal extensor tendons of the wrist, we can see that the first compartment is okay, the second compartment looks fine. The third tendon complex is also good. It is tracking along the Lister's tubercle, looks fine. The fourth tendon complex is good. The fifth extensor digiti minimi is fine. However, now we see the culprit here, that the extensor carpi ulnaris is moderately thickened and edematous. There is fluid in the tendon sheath, and there is extensive, peritendinous soft tissue edema. So the involvement of the tendon is approximately 2 centimeter in length, and extensive inflammation we can appreciate in the surrounding fat. Okay, and when we come towards the flexor compartment, we can see that the tendons look good, but however, as it is entering into the carpal tunnel region, we can see there is trace fluid in the flexor digitorum profundus tendon sheath. The median nerve here, which we can appreciate on the proton density images, looks fine. On the fat sat images, it shows normal signal intensity, so there is no features of carpal tunnel syndrome on imaging, while the ulnar nerve is absolutely showing normal signal as it is entering into the Guillaume's canal. And the final diagnosis is a long segment non-insertional extensor carpi ulnaris tenosynovitis with moderate to extensive peritendinous soft tissue edema corresponding to the site of ulnar-sided wrist pain. So this is a case which is one of the most common tendon to be involved, specifically in cases of early arthritis or in patients who are repetitive keyboard workers or surgeons who routinely use their wrist, specifically the surgeons and gynecologists. So, and otherwise metabolic changes can also cause degenerative changes in the tendon and result in tenosynovitis. Thank you.